Hello, I'm Simon Alsop, the founder and head of Barrington James Board and Executive Partners. We are a life science industry executive search firm appointing chairpeople, board members and executives all around the globe from our offices in the United States, Europe and Asia Pacific. Welcome to the CEO series, the podcast in which we will uncover the secrets of successful leadership in the life science industry. And we'll do this by talking to some of the most progressive and talented chief executives in the field today. The interview today is with the brilliant Lisa Anson. Lisa is a board member of the Bioindustry Association and the chief executive of Redx Pharmaceuticals. Having begun her working life as a consultant with KPMG, Lisa then embarked on a 20-year global career with AstraZeneca. This saw her build businesses in the United States and Europe. In 2018, Lisa left AstraZeneca and took the bold decision to take on the chief executive role at Redx Pharma. Redx was a company which, despite exciting and proven science, had fallen into receivership, and Lisa took on the challenge of rebuilding and reviving the company from its lowest point. The subsequent turnaround story is one of the more remarkable in the industry. Today, Redx have multiple programs in the clinic, some wholly owned and some supported by relationships, partnerships with global pharmaceutical companies, and a rich preclinical pipeline to boost. The company also recently delisted from AIM, supported by a strong institutional investor base. It is a great turnaround story. So let's go see our interview with Lisa Anson. Lisa, great to have you here. I want to start actually by going back to 2018 and talking about your decision to move to Redx. How big a risk was it?
Well, it was a risk. Of course, it's a risk moving into a company that has been in administration. However, any career is built around, in my view, taking some risks if you really want the opportunities. And for me, it was exactly the right move to make. I wanted to move to a smaller organisation where I could make a bigger difference. I felt passionate about the fact that British science really had a lot to offer and it was a great basis to build companies. And Redx was just a good example of that. It had some very good science, really good team, but it had lost its way from a sort of leadership and financing point of view. And I felt there was the basis there for a turnaround. So I think that judgment was important to manage the risk. But also I've been running an organisation within AstraZeneca that was pretty significant. So although it's not called a CEO role, I had a lot of experience as a general manager and I felt I could make a difference. So for me, it was a risk, but that was the fun of it.
So what were your first priorities?
Well, I think as any new situation, and I've been in a lot of them through my various roles in my career, any new situation, first thing is to really understand the situation. So understand the people, take the time. I mean, there's a tendency, and this might come back to one of your later questions, particularly for new CEOs or for anyone in a new situation to want to rush in there and solve it and make a difference immediately. But I think it's important to always take the time to assess the situation, assess the people, to listen, and then to formulate your strategy, and then to really engage people in that strategy and then move forward. And that investment in time up front is quite important. A lot of people talk about 100-day plans. I'm sure many of your folk have thought about that. And I think that's a really good reminder that you don't have to make all the decisions in day one, month one. Now, sometimes many leaders make a symbolic decision very early to signal where they're going. I think that can be helpful. But in my view, they're taking that time to work out the strategy. So that's what we did. We took a couple of months to work out what we needed to do, talk to the people, work out what the team's strengths were, work out what was needed, and then move forward together. And I think that was a very worthwhile investment of time.
Can you remember, Lisa, what you uncovered in those early months, both good and bad?
Yeah, I mean, I think there was a very good science team. So I've met, obviously, with all of the science team, and that didn't surprise me because what the team had delivered before, what I had learned, I guess, in my due diligence around taking the role. I think there was a very poor basis of financing because we were AIM listed with a lot of retail shareholders, but being a very early stage preclinical company didn't necessarily have the data flow or the specialty of investors who could understand really what we needed to do. And therefore, it was slightly mismatched in terms of what we were trying to do with the investor base that we had. So that was clearly an issue. Funding was also going to be an issue. And the fact that we were spread quite thin across a lot of programs, there was no real focus to the business. So some of the early decisions we made were really moving the investor base, really picking a couple of programs to take forward into the clinic and doubling down on those, if you like, and then making some decisions to partner, which had been not done enormously before, to show not only could we raise some money, but also show the quality of science was attractive to large pharma. So I think broadly, we didn't change the organisation a lot. We really focused on those aspects of financing, the partnering, and progressing some programs to clinic.
Okay, great. If you think back, Lisa, to maybe when you accepted the offer to join, and you must have had an idea about what was possible or a vision for the company.
Yeah.
And now if you reflect with the benefit of hindsight, how closely is that aligned to what's actually happened?
Well, I think there's been huge progress made, and I'm very proud of that. And I think people talk about a turnaround that you've done, and I'm like, no, it's never done. So it's running any company. You always have new challenges coming through, new situations, and I think in some ways it's almost easier to come into a situation that's difficult because then anything you do looks really positive. I think actually more challenging is then to reinvent the next stage of the strategy and to continually do that, to put yourself in a position where you have to, break a few eggs, if you like, and reinvent the strategy and go again, because you're never done. And as a CEO, it's kind of, you have to have your finger on the pulse of when to push the organization out of its comfort zone, do something new. So, for example, or to make a big decision that's quite difficult. We had to make that decision earlier in the year and say with one of our lead programs that people had worked very hard on, there was a lot of scars to get it into the clinic. People were very excited and passionate about it with regard to what it might do for patients. We had to make a very clear decision that actually, for the company, we had to try and partner that. We are actively trying to partner that program now because we needed to focus on our next generation program, which is what we decided to build the company around. So it's almost like there's a series of different turnarounds, and sometimes you get a setback. This is a sector where inevitably the science will surprise you, and some things work that you thought would work won't, and some things you didn't think would work won't. You have to be able to continually reevaluate, are we on the right path? And I think we're still going through that. So I still feel there's a sense of challenge there because you're not done. And I don't know when you're ever done in terms of, have we got something to market to patients? No. So until you've reached that milestone, I think you continue to keep reinventing and pushing the strategy.
I hear you. The job's never done. But what you've done already is very, very impressive. I think 3 programs in the clinic as of today, some partnered, some wholly owned, and more coming.
Yeah, I mean, the team here have delivered 6 molecules into the clinic over the history. And I think that record is phenomenal because, as we all know, lots goes on in preclinical and discovery that never makes it into the clinic. So just that milestone. Now, it's interesting to me that 3 of those assets are with other companies now and 3 remain with us, but they're all continuing in their development. And one of them is actually approved. So the fact that the team has been able to deliver a molecule that is currently treating patients, I think is incredibly impressive.
Lisa, you made the move that hundreds and thousands of people would like to make, from a GM position in maybe a multinational to a CEO, accountable CEO in a listed company. How big a step is it?
I don't think in terms of is it a big step? No, it's a different challenge. And I think the first thing I would say is it's fantastic. So if anybody's thinking about it, I've never looked back, and it's been a great move for me, and I've loved every minute of it. it has a different set of challenges. And I think any leader has to have a degree of self-awareness. I think that's fundamental. And I think you have to know yourself and what your real strengths are and where you get real satisfaction from and where you can really make a difference. Because not everybody who enjoys working in a larger team with a lot more resource and a lot more expertise would be able to have the kind of rounded, turn your hand to every challenge that you do in the biotech CEO. You have to have a broader range of skills. You don't have such deep resources around you. So I guess you have to roll your sleeves up and just be prepared to get stuck in, get on with it, trust your own judgment, and be able to build a more external network to reference where you get support from. If that is not something that inspires you, then I think it's not something that you're going to really thrive on or enjoy. So I think it's a case of knowing what suits you. For me, I really like difficult situations, turnaround situations, crises, and getting stuck into that team and mobilizing a team around that. And I did that quite a number of times at AstraZeneca. Yeah. I think sometimes in these big pharma, and this you may get this, Simon, when you're looking at CVs and recruiting people, I'm sure, sometimes you don't really get a feel for what's actually behind the big global roles. And the experiences can be really different.
Fantastic. I want to sort of go into really your formulative experiences that, maybe the leader that's ready to step into a role like this. So maybe let's sort of rewind a long way, relatively long way to like your early professional experiences. Can you remember your first notable boss or bosses and what impressions they made?
Yeah, I mean, I had a science degree, but I went into consulting, and I think that was a really good general business training. And I had quite a number of experienced managers that I worked with. So the first thing I picked up quite quickly is you can learn different things from different people. And they don't have to be a formal line manager, just could be anyone in your team or anyone you're working with. I was just, I guess, hungry to absorb and get stuck in. So there are a lot of people who ran projects that I worked on in those early years that I learned different things from. And, working hard, throwing yourself into a situation. We had a lot of different clients. And so finding ways to get up a learning curve very quickly and assess a new situation was really important because, the client might have hired a consultant and, you had kind of a week or 10 days to learn. But then, as most people get fed up with just teaching the consultants about their business. They want something back. So you really had to have an accelerated learning curve and learn how to deliver value or insight or something and figure out what that was. So a repeated experience with different managers of trying to say, how do you assess the situation and how do you work out something that you can deliver that's of value, and seeing how different people went about that was really instructive to me. And it really helped me to then throw myself into new situations without fear, to say, I can deal with this. I don't know what I don't know, but I can deal with this. And I think that was really the lesson from my early consulting career.
You alluded to some crisis management. Can you think of maybe one particularly tough crisis that you had to lead people through?
Yeah, so I think at the time, people were not so au fait with vaccinations and pandemics as they clearly are now. So before the current pandemic, one of the things that we did at AstraZeneca, and I believe it still goes on to this day, is supply the childhood vaccination program for flu, which is obviously one of the things actually that the UK was quite good at. It's a different type of skill set to preparing for a pandemic, but having that flu jab. So we had a nasal spray, which was for children, which was the vaccine of choice for the entire immunisation programme for the UK. And the supply went down. And this was a marquee programme for AstraZeneca. It was a marquee programme for the NHS. It was a sole supplier because it was a unique product. And you have a 6-week window where you need to vaccinate everybody. So your supply goes down, the whole thing can go out the window. And a lot of resource has been put in by the NHS to have the facilities to deliver this. So we basically got the challenge, right, supplies going down, deal with this. We've got 2 weeks to get this sorted out. And there's a lot of external parties involved. So there's all the people who are suppliers to AstraZeneca, the US manufacturing base, the NHS, the team that I was working with, all of the GPs and nurses who were delivering it. So it was quite a complicated chain, and we had to manage that. So I look back on that and say, that was fun because it was a great team. It was a great team spirit. It was a 24/7, all hands on deck. We're going to solve this, and we did. But we didn't know how at the beginning, and we had to kind of block down the barriers. It didn't really matter whether someone was inside AstraZeneca or outside AstraZeneca. We had to work as a team and get it done. And I think there are examples of crises like that where you do come together and create that focus and momentum, and that was one of them. And I was very pleased to be able to say we did actually manage largely to get all of the supply to the right place at the right time, but it was, almost, it was micromanaged down to the last kind of hour and the last packet to make that happen. And I learned a lot from that because you figure out that when people's backs are to the wall, they can deliver things that they wouldn't otherwise do.
Yeah, I guess listening to you, Lisa, it makes me think that in a crisis situation, you've got license as a leader to ask for a bit more from people, and the right people will rise to that challenge, so you can do extraordinary things.
Yeah, and then I think what's interesting is how do you take some of those lessons and apply them to more the day-to-day business and create those same conditions. No one person has all the answers, right? So in a crisis situations, you're very reliant on your teammates, and so it completely throws out any hierarchy. And I think that's quite interesting in terms of what you're going to get in biotech is you don't have that type of hierarchy. No one person has all the answers, but you are very much acting as a small team, kind of trying to make something happen in the big healthcare sector. And it is interesting to me that as an observation, the number of new drugs, new molecules, new discoveries that come out of small companies, when you would think rationally that the guys with much bigger resources, much bigger teams, much better setups might be able to deliver better. It's not proven that R&D is more successful in big units and small units. Now, there are certain things that require critical mass, obviously, and I think in developing drugs, there are benefits to scale. But in the actual discovery, a large team is not necessarily better than a small team, and I think that's quite useful to remember.
So Lisa, that leads me to the topic of working with R&D teams.
Yeah.
The majority of your people at Redx are in research and development, aren't they? Yeah. So working with scientists, developing leaders from scientists, is there a knack to that?
Yeah, I think it's always difficult to generalize one type of person because you get such a variety of different scientists. But I think in general, there is a very kind of technical bias and rational bias to the way they work. So I think understanding how to manage people, communications, engagement can be more challenging for many scientists, and not everybody wants to take on a leadership role. So I think one of the things I try and do is give scientists the freedom to operate. So the kind of culture of the company is about taking the shackles off them, allowing them to do their thing. They know that I can't do their science better than them, right? I know that. So it's not about doing their job better than them. And I think when you move away from that kind of hierarchical thinking, which I think is quite old-fashioned now, even in non-science businesses, it's about giving them the best chance of success. And for some of them, they just want to get on and work on their own. Others actually do excel at building teams. And so I try not to say that success is getting promoted to being a team leader, right? Some people don't want to do that. And I think there can be a sentiment that you have to be promoted, therefore, to be a contributor in some of the large companies, whereas we can say, no, you're a fantastic individual contributor. Yes, you need to be able to work as part of the team, the Redx team. And we have a really nice scientific culture that includes people. And I think that's one of the most consistent things I get feedback is people really like working here. They really like the open, collaborative culture. And that's a credit to the scientific leaders because day in, day out in the lab, they're helping each other. They're helping solve problems. It's completely open communications. We have a very clear set of culture values that they all came up with. I didn't come up with, they came up with themselves.
Right.
About what it is that makes a culture really nice. So agility and high standards and resilience, teamwork, innovation, those are the 5 kind of pillars. That making those explicit has really helped people. Having said that, we do try and work on communications a lot with the scientists. And I think we see that in external communications. For example, presenting to partners, presenting to investors is a very different thing than just presenting at a scientific meeting. And that business communications and leadership communications is something that I think is worth investment on for the scientific team. Because if you can build that, there's some fantastic leaders there.
Let me extend a bit beyond the R&D team. If you're recruiting a leader for Redx, and it could be a commercial leader, it could be an R&D leader, it could be an operations leader, is there a fundamental or sort of core value or characteristic that you look for?
I think a lot of the leadership attributes can be coached. People often ask that question if you're coming to. But I do think there are some fundamentals that really help. So for me, resilience is a big word, particularly in our sector, but I think in any business setting. And the ability to deal with what's thrown at you, I think, is quite important. Yeah. 90% of discovery programs will fail. So if you can't deal with that, if you can't make tough decisions to stop programs, if you can't get people re-engaged afterwards, then if you don't have that resilience to continue, I don't think you'll succeed in a sector. So I do think that there's an innate characteristic of resilience. I would also pair that with judgment. I think you do need good judgment as a leader. You won't get everything right. It's not about getting everything right. You do need to be able to make decisions. But you've got to have judgment that people trust you on your judgment, whether it's the board, whether it's your team, whether it's yourself, your colleagues. I think you have to have some judgment. And now some of that comes from experience, some of that comes from intellect, some of that comes from just an innate feel of this is the right thing to do in this situation. And so I do think judgment and resilience are quite important to look for. And then I suppose if I was going to go for a third, it would be some ability to engage. Now, people engage in different ways with people. I'm not saying that, it's your social live wire type of engagement, but do you have an ability for people to follow you or trust you? Can you inspire people? Can you get people to do things that they wouldn't do on their own? Some sort of ability to engage people around them, whether formally or informally, that sort of natural leadership that people refer to. I think about it as, can you engage people in your mission, in your judgments? And I think that is quite important. So I would probably look for those things.
Yeah.
Resilience, judgment and engagement.
Brilliant. And certainly, Lisa, working with your team, which we have done, that reflects. It's been a really good, clean, professional and sort of targeted experience. I feel like we haven't wasted any time. It's been, it really, I think, reflects those values.
I people say impatient, because that's one of the things I'm known for. One of my favourite phrases is, with patience you can achieve a lot, but with impatience you can achieve more. But that sense of, we're in a hurry to get there, that kind of, if it's excitement, it's like there's some buzz, there's something going on here that you want to be part of. That's good. Obviously, if it's impatient, as in not allowing anyone time to be considered or not being able to reflect on it, can become negative. But that, I do think that creating a sense of excitement and buzz and impatience to get something done is a real positive in biotech, because that's actually what keeps people excited on a day-by-day basis, that they're doing something worthwhile and we want to kind of progress it forward, even though some of these projects take really quite a long time.
And that is a common trait, Lisa, across the best CEOs that we work with. So we're always continually working to exceed expectation and to deliver things quicker than expected, but the best CEOs always push us a little bit faster. So I see that. So I've got a few quick fire questions, Lisa, sort of short, sharp questions for short, sharp answers if we can. What's the best part of your job?
Freedom to operate.
Great. What's the worst part?
Lawyers.
What keeps you up at night?
Uh, I guess safety, patient safety is probably always one of the biggest worries when you're running a company.
Yeah.
And separately, but almost as importantly, fundraising.
Yeah, of course. Okay. In a single word, maybe two or three, what defines great leadership?
I would frame it as delivering potential, be that the potential of the business or the potential of the people, but both. So, every company has potential, every people has potential. So as a great leader, can you kind of not just extract that potential, but actually deliver something from it? I like the delivery focus and igniting potential. So if I put those together, I'd probably say delivering potential.
Yeah, I like that. Can you name a leader in any walk of life who you find inspiring?
It's a surprisingly difficult question because you like to get different things from different people. I really admire Bill Gates, not because of Microsoft, although I think that's incredibly impressive, but I actually think how they are going about trying to make a difference in the world with spending the money that they have, I think is transformative. So you see people get excited in our sector when the Gates Foundation comes in and funds something that nobody else will fund because they can. And I think that idea that because you can, you do, I really like. So I have a lot of respect for that. May sound quite British and backward looking, but I actually think our recent Queen is an incredible role model. If you think about the change she saw in her lifetime, the male dominated world that she presided in, and the way she stuck to her values in different situations over an enormous amount of time. Her values became quite lauded. They weren't always lauded at different times, but she stuck with them. So I do admire the ability to hold your values through an incredible changing world and situation. And at the end of the day, I think that was recognized with her. So that's what I would take from that example.
Yeah, Lisa, I've been glued to the Crown this year. I've been through all sorts of years. And it's a great perspective on that. But I agree that those seismic changes in society over which she presided are just, staggering. Okay, let's talk a little bit about the industry then, specifically before we wind up. The industry's had a tricky 18-month, 2-year period. To what extent do you think pharmaceutical companies, biotech companies are responsible for the plight of the industry currently?
What are you thinking about specifically? About funding, about valuations, about what are you thinking?
I'm thinking from a leadership perspective. Is there a lack of leadership in the industry?
Well, I think in our sector, there are so many types of company. So I always think of it as an ecosystem with large pharma and small pharma, the sort of supporting services, investors and academics, and healthcare delivery. So within that sector, there are parts that have done very well at times and parts that have done less well. I mean, I think, the industry had some huge breakthroughs, with the whole pandemic, brought it to the forefront of society. In a way, I always used to say no one wanted to talk about our sector in the pub, whereas after the pandemic, they do want to talk about our sector in the pub. There's a lot more general knowledge, which I think is a good thing. I mean, if you look at the obesity drugs and GLP-1s, there's lots of examples of areas of the sectors that have done well. But I think in general, the climate has been hard, particularly for biotech in terms of fundraising. Some of the froth has gone off the valuations. There are a lot of companies that have money that arguably shouldn't have money, and there are lots of companies that want money that are arguably struggling to fundraise, even though they've got very good programs, although that's starting to come back. In the UK, I think there are a lot of really good companies, and I do think there is a leadership challenge that goes a little bit hand in hand. I think we're very good at the early science and discovery. I think we've got less skill set for building companies and getting the confidence of those scaling companies. And that's what comes with the significant fundraisers. So, and that's what then you need to take a company through the development stage and ultimately on to getting drugs approved. So if you're some of it is around the whole dynamic between investors and the biotech, and some of it is around leadership. I wouldn't put it all at the door of leadership, but I do think we could do with a greater variety of leaders in the biotech companies. I don't always think that some of the founders, academics, create huge companies from the science, and not always the right people to have in charge. Equally, you do need people who are scientific, and you don't always want a generalist CEO. So I think getting the right CEOs in the right companies is always going to be critical. It's particularly critical now because investors need to have confidence in the CEO, or they're not going to invest in them. Full stop. Yeah.
So do you think CEOs might come into the industry from other industries to bolster that talent
I
base?
think people often ask that. I think it's a tough one because some of the things that are important, like judgment that we were talking about, engagement, prioritization of projects, you need a really good understanding of the science. And I see it with board members who are less biotech or pharma orientated. There's struggle with like, well, what's a phase 1 study, and what's important for a regulatory file? Why are we doing it this way? Because of the regulators or whatever. And there's so many layers of the sector that I think it can be a particularly challenging sector to come in. Where I think there's much more is like yourselves as life sciences experts, where there are services that focus on life science. So there's banking practices that focus on life sciences, all sorts of healthcare related industries. I think there's a lot more move within that ecosystem that could be made for leadership. So I think leaders can come from all sorts of different areas, but I think some experience of healthcare, drug delivery, patient care, regulatory, or the life sciences sector, I think is always going to be helpful. So, for example, would a big tech leader be able to come in? Well, obviously in some of the AI companies, that could be incredibly helpful. But I think you're also going to need some understanding of the sector, or else have the ability to really have a great team around you. So yeah, we'll get some more adjacencies, but I think, could you just come from other sectors? I often talk to I was at INSEAD at business school, and we have a very good network across a whole load of industries. And I find that really helpful because it does get me outside of our sector. But there's 3 or 4 of us in the healthcare sector, and there's very little transmission between the two areas. And frankly, I don't think many people would want to make that jump now in their career, even if they've taken on more portfolio careers. So it is an interesting one, Simon. I never say never, because there's always an exception. But I think in general, it really helps to have some industry expertise to take on these biotech roles.
Yeah, and if I think about our experiences, Lisa, replacing board members and chief executives and other C-suite positions, there's a far higher proportion of the board seats that we appoint which do bring diverse industry experience, as opposed to the C-suite where, understandably, we come back to industry experience as a foundation to build upon. Okay, well, Lisa, we could carry on, but we are going to run short of time. And so I'm going to ask you one sort of final question before we wrap up.
Okay.
If you had one piece of advice to give to maybe Lisa Anson in 2018, or a new first-time CEO in the industry stepping into the job, what's your best bit of advice?
Yeah, I think I would say back yourself, right? I've talked a little bit about judgment through this call. I think when you go into a situation where you are the CEO, I think you have to have confidence in your judgment, whether it's to listen to someone else on a decision or to make the decision yourself. That remains to be seen, and your colleagues. But I think you have to back yourself in terms of what you're going to do, and have that belief that you can make a difference. And as a first-time CEO, I think that is the most important thing to say. You know what? You've been put there for a reason. You've taken this role for a reason. People believed in you, put you in this role. Now back yourself on those difficult situations, because you do have to rely on your ability to assess a situation. So back yourself, closely followed by a comment I made earlier around don't rush. Now, some people may have heard me say that I'm not a patient person and that I like to have things with impatience. So why am I saying don't rush? I think it comes back to that. Take the time, particularly at the beginning of a role, new CEO, new job, really keen to get stuck in and get stuff done, take that 100 days, assess the situation, set your strategy, align and engage people. So determine what the future is, engage people around it, and then you'll deliver. Don't try and do the delivery first. So don't rush headlong into that. So I think that's why I like that 100-day mentality. That's a kind of secondary piece of advice. I think I would always go with back your judgment first, closely followed by don't rush.
Lisa, I might steal that at some point when we're advising someone taking that step. But, well, thank you. This has been absolutely wonderful. Some really fascinating insights, which our viewers are going to love. Impatience, resilience, judgment, engagement. I love that as a group of attributes to assess leaders. And going into a new job, back yourself and don't rush as a new CEO. There's loads. It's been brilliant. Thank you ever so much. And I just want to say best of luck for Redx in all that's ahead, and best of luck for you in your continued career as a leader in the industry.
Thanks very much. Appreciate it. Enjoyed the conversation.